Yeah, just a quick review of the OA unloader knee brace. So OA stands for osteoarthritis. So that's basically just kind of there's different kinds of arthritis, but this is kind of like osteoarthritis, like the wear and tear kind of arthritis. It's the most common. But anyway, so this brace is basically made for people that have some kind of knee pain or having some kind of knee problems. The idea here is that you put on the brace and it's supposed to support the joint and the surrounding soft tissues, the muscles around the knee. It restricts your knee motion, and that way your knee has a chance to rest, recover, and it doesn't get so overstressed as you're doing things, and that equals less pain. So a few points about this particular brace. What I do like, it has these quick release buckles. So once you get it all adjusted and everything, and you need to take it off, you just hit that and you push down, it just comes right off. So that's really handy. So you shouldn't have to actually readjust it again after that. The other thing is it does have this varus valgus alignment. So that's like varus is when your knees are kind of making like a L shape like that. So it has an adjustment that it can go in like that. And then it has a varus, which is just the opposite, where it's kind of like it goes this way. So that way it would come out like that. So it does have like think of it kind of like a medial to lateral kind of adjustment on there. But anyway, other things you can do besides put on a knee brace, just getting this from Bulletproof Your Knee. It's just one resource. If you're having any kind of knee problems, make sure that you strengthen your quadriceps muscle. And your quadriceps muscle is a big muscle on the top of your leg. And here's your kneecap just for reference. So it sits above that. It's actually made up of 4 different muscles, but collectively called the quadriceps or the quad muscle. And it is key in stabilizing your knee joint. So it's the big stabilizer of your knee. What they're finding is that people have various problems with their knees. They have a selective problem with just their quadriceps. It's not their hamstrings or their adductors or that kind of thing. Basically, it's just, for some reason, the quadricep muscle takes a hit. So for instance, like knee swelling in the quadriceps. Here's something. Another study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So, if you have chronic swelling or any kind of acute swelling, like you just hurt your knee, it can take its toll on your quadriceps. Knee injuries in the quadriceps, if you've broken like your lower leg bone, you fractured your tibia, surgical opening of the knee joint, if you had knee surgery before, researchers find when they look at people that have had those issues, the quadriceps is a lot weaker than normal. Ligament problems in the quadriceps, anterior cruciate ligament, that's also known as the ACL. And if you've heard of football players, tearing their ACL. So for instance, one study looked at people that completely ruptured their ACL. Researchers found the strength of the quadricep muscle was injured in the injured leg was decreased by 25 to 30%. So you take 25 to 30% off the strength of your quads, you're compromising a lot of knee stability. It's kind of hard to get better and get pain-free from that. So definitely you need to be strengthened. Posterior cruciate ligament, they're finding the same things. Medial collateral ligaments, all the ligaments around your knee. Knee pain in the quadriceps, people have like chronic knee pain. It takes its toll on the quads. Knee arthritis in the quadriceps. So this is interesting. If you Google like knee arthritis and quadriceps, it's pretty much consistent in the literature that if you take a group of people with knee arthritis and you test their quadriceps muscle are really weak compared to the other muscles around the knee. And likewise, there are randomized controlled trials showing that if you actually take a group of people with knee arthritis and you strengthen just their quadriceps muscle, that their knee pain starts to go away. And even more interesting, some of these studies are even showing that the people that have the stronger quadricep muscles actually have the least progression of their knee arthritis. So the stronger your quads are, there's a good chance that your knee arthritis won't progress anymore. Patellofemoral pain syndrome, the list goes on and on. Any kind of knee problem, definitely make sure that you do at least one exercise for your quadriceps muscle. Fine-tune control over your knee. Here they're talking about the hip muscles. Sometimes you have a lot of knee pain and there's nothing wrong with your knee. It's the problem up at the hip. There's some kind of dysfunction. So classic cases like iliotibial band syndrome. So if you take a group of people with iliotibial band syndrome and you muscle test and you test the strength of the muscles around the hip, researchers find they have unusually weak hip abductors. And that's a key muscle to keep your pelvis level, as you're walking and brings your leg out to the side. And likewise here again with knee arthritis, take a group of people with iliotibial band syndrome and you strengthen just their abductors, iliotibial band syndrome starts to go away. So that's pretty interesting. Optimize knee flexibility. We all know your knee should be able to bend and straighten fully. A lot of people don't know is that your knee actually rotates. So about the last 10 to 15 degrees of you kicking your leg out and straightening your leg, your knee actually rotates laterally or out to the side. Here's a little test to see if you have that motion. So that's an accessory motion that you really need to have a fully functioning knee. So that's always a place to go if you're having chronic knee pain. Increased dynamic knee stability. Here they're talking about proprioception. So if I suddenly turn the lights out, you'd probably be able to tell me if your knee is bent or straight. And that's because your proprioception, which is due to you have joint receptors in the joint and receptors, like nerves in the muscles around the joint that constantly give your brain feedback as to where your knee is in space. So that way you know exactly where your knee is all the time. Well, the problem is they're finding that people with a lot of different knee problems, they have decreased proprioception. It's not like they don't know where their knee is. It's just it's not what it should be, and that has implications in terms of like reaction times. Like say if you unexpectedly step in a hole or off a curb or something, or some unexpected movement, you need to know exactly where your knee is precisely. That way you can contract your quads real quick and stabilize everything. So if it's not up to par, you could run into trouble. But yeah, so anyway, other things you can do. But hey, nothing's as quick as putting on a knee brace. So this is a pretty good one. So check it out.